Welcome back to Healthy Living. As we talked about in the first segment, we were talking about back to school, and we're talking about things parents can do for their children and also for themselves to get ready for back to school. So now joining me, we have Dr. Linda Keefer, and she is with St. Tammany Pediatrics. So thank you so much, Dr. Keefer, for joining us.
Well, you're welcome, and thank you for having me. It's my pleasure. Yeah.
Well, we know that when kids are getting ready to go back to school, parents are focused on making sure that, they have all the right school supplies and all the things they need, but there are other important things that parents, need to be made aware of and reminded of, and I'm one of those parents, as we talked about earlier. You need a few things: childhood immunization. Sometimes you might need a sports physical. You might need a wellness visit. All these things are important to do before school starts. But before we get into that, let's talk about you. Let's get to know you a little bit for people who might not know you. What do you do for St. Tammany Pediatrics, and tell us a little bit about your care philosophy.
Okay. Well, actually originally I got my bachelor's from Loyola University in New Orleans, and then I have a PhD in biochemistry, and I did scientific research for a while, and I was on faculty at LSU Medical Center for 6 years or so when I decided I really wanted to go to medical school. So then I went to medical school at LSU, and I went into their internal medicine and pediatrics combined program and practiced as both internist and also as a pediatrician.
Oh, good.
And came to the North Shore in 1997, and I've been part of the St. Tammany network since 1999. And about 5 years ago or so, I really missed having more kids. I really wanted to get more kids in my practice. So I've been focusing on just pediatrics since that time.
So I'm sure you know a lot of families here on the North Shore.
I do, and I love that. And part of what we try to do as pediatricians is to help guide families in raising and caring for the children and educating everyone about what is the healthiest way to approach your life and the care for your child. And we try, we work with individuals because everyone's different,
right?
But we really try to just kind of help coach them a little bit along the way.
Well, that's great to know. It's a nice, well-rounded system of care, it sounds like. So that's good.
Yeah.
So let's talk about back to school and immunizations. A lot of times children will go back to school and they need certain immunizations at certain ages, and I'm not sure if parents know if that is a separate appointment. Do you have to schedule like a wellness visit for that, or can you just schedule immunizations? Yeah. How does that work? What would you advise for parents?
Well, most of the time, one of the things that we do at the well visit, which we encourage everybody having every year if they're due vaccines or not, is that's the time when most often we will give immunizations, and it gets updated constantly because there are new recommendations for what's good to have or when to have it,
right,
in terms of shots and things. This year, example, the state has passed a law previously that is now the hepatitis A vaccine is one of the required by the state.
So that's new
vaccinations. Yeah, it's new, but it's been phasing in since January. So it's one of those things. Most kids have 2 doses already, but because of the way that it first came out and was administered to just younger kids initially, and then recommend later for the older kids, there are some kids in that middle to teenage range that may not have had them, or some states still there are children who haven't been getting the hepatitis A.
Right.
So that's something that they do need to get, and they're supposed to have 2 doses by the time they start school this fall.
Okay.
If someone has already had a well child visit that year with our clinic, and then it turns out there's a new requirement like that, for example, and they need to have a vaccine, then in our practice at least, certainly we can give them that vaccine as a nurse visit.
Oh, good.
But if they haven't been seen in a period of time, then we would like to see them first.
Right.
Which is one of the reasons why keeping up with the well child visits helps to maintain that kind of ease.
Sure. And what should parents should probably avoid certain conditions where they wouldn't want their child to get a vaccine, like if you have a flu virus, or if you have fever or something like that. What are some things that they should avoid?
It's usually fever, if they're having fever, or they look like they're about to have fever because they've been sick. Now, if they have a cold that they're recovering from and they're doing fine, or they just have their allergies and they're doing fine, those are not reasons not to get a vaccine.
Okay, gotcha. And let's talk about once they get the vaccine. Like if you're should you not do it right before school starts, like the day before, for some kind of, in case they have a reaction to it, or are there any parameters around that necessarily?
It kind of depends. Vaccines that are what we call live vaccines, like the MMR and the chickenpox vaccine, the varicella vaccine, those are a little bit more likely to possibly cause fever and achiness for a day or two afterwards. So those, it might be a good idea to give them a couple of days in advance at least.
Okay.
Many of the other ones usually don't provoke that kind of response.
Okay, so let's discuss the well visits, because you were talking about the importance of well visits. Why are they so important? Go a little bit more deeper into why, because I don't know that every parent understands the reason why they're so important.
Right. Well, you know, at the well visits, we usually take an extensive set of vital signs like blood pressure and pulse, and height and weight, and we plot them on the standard curves that we have so we can discuss with the child and with the parents how they're doing in terms of their growth and development.
Right.
We assess a number of different things that the families may not have been aware of. We go over their diet, what types of foods, and the latest trends for what's healthy to do, and whether or not someone's being prone to constipation, which is a big problem that many times doesn't go noticed, because after a certain age, parents aren't really seeing what their kids are doing, but it can play a role into their function.
Sure, into their health.
Yes, and we go over how they're doing in school, the reading, and if there's any other kinds of issues that oftentimes the parents may not have actually been aware of.
So it's not just physical health. You can kind of get a mental picture and an academic picture and cognitive function and all that. Okay, well, that's good to know. So let's quickly touch on sports physicals, which we talked about a little bit with Dr. Reed, but sports physicals, if parents need a sports physical, is that something you can provide? Oh,
yes, definitely. And like I said, we oftentimes, when we do the well visit, we often cover a lot of the same things that would be needed for a sports physical.
Okay.
And so a lot of times that will substitute for that.
Okay, perfect.
So sometimes it's more convenient to come in earlier during the year for the well visit.
So I think they count for a year usually.
Yes, they usually count for a year.
Okay, good.
As long as there hasn't been an injury or
since
something
the well visit.
Since the well visit. Yeah.
Okay, and real quick, because our segment is almost over, but I was very much a stickler for my children washing their hands right when they got home from school and taking their uniforms off because of things they might have been exposed to at school. Are those some good tips on how to keep yourself healthy, and what other things would you advise for parents to teach their children when they're in school?
Definitely washing their hands frequently, trying not to touch their mouth, put their hands in their mouth or their eyes. Rubbing your eyes also is a good way to get an infection, through hands to the eyes.
Okay.
But other things too is getting plenty of sleep in general, because many children, especially when they get busy in school and sports, they're not getting enough sleep, and they really should be trying to get at least 8 hours of sleep a night.
Okay.
And one last thing about that, a lot of the kids are completely off their sleep-wake cycle for the summer. This is definitely the time to start getting them weaned towards waking up early enough to go to
Back
school.
on that schedule.
Yeah, it takes almost 2 weeks to get them well acclimated again.
Okay.
So it's a good thing to do.
Okay, we want to thank Dr. Keefer for joining us, but stay tuned because our next guest is Bethany Monaster. She's a registered nurse, and she's also the manager of our trauma services for St. Tammany Health System. We'll be right back.